Morning everyone. It's my last video before I go into surgery. I just wanted to run you through the appointment that I just had yesterday with my surgeon. It was the first time I actually met him in person, and it'll be the last time that I see him before I have the surgery. The surgery is in 4 weeks. We are in lockdown again in Melbourne because of Corona, and so I'm actually just crossing fingers and hoping that it all goes ahead. At the moment, elective surgeries are actually still happening, so just fingers crossed it's all okay. So I went in to have my appointment with him, just masks and stuff, obviously, and it was really a bit of initially just a kind of opportunity for me to ask him any questions that I had. They were predominantly around recovery because obviously that's what I'm most concerned about with a 2-year-old. The plan is for my sister to come and get me from the hospital and for me to spend a week with her. My husband will take a week off work and stay with my child. The main reason for this is because Billy, he's got a lot of sensitivities. He's got sensory processing disorder he had a stroke when he was in utero, and he has mild cerebral palsy, and he's just very sensitive, and he just wants to be on me all the time. I'm the only one that can put him down if I'm at home. My husband can do it if I'm out of the house, but if I'm home, Billy just won't have it. And he's just on me a lot. And the doctor was just reconfirming that yes, it would be a good thing for me to not have to deal with that, because what happens is the blood vessels develop like little plugs at the end of the blood vessels, and if you have high blood pressure or if you have pressure applied to your breasts, then these plugs can come off and cause bleeding. So we want to avoid that. So it kind of took me through what the day would go like. So I need to fast from 2 a.m. the morning of, but obviously I'll be asleep. So it'll be from like dinner time the night before. Then I go in, I have to be in at the hospital at 6:30 a.m. and the surgery will happen. I'm the first cab off the rank that day, and my surgery will happen at 8:30. They gave me a link, and I've gone in and pre-registered with the hospital, given all my details, all my Medicare and all that kind of stuff. All the paperwork requirements have already been done by me just at home. So that was good. So the surgery, as I said, will be at 8:30 and it'll last for around 3 hours. It's going to be a slightly more complex surgery for me because, I'll run you through that. Basically, like they measure and they figure out, he measured and figured out how he was going to do it, and it's going to be a little bit more complicated, but I'll explain that. Anyway, so about 3.5 hours is what he was saying, and then I'll come out. My sister will be there. No. My sister will be there the following day. So I'll just come out of surgery. I'll stay there overnight. Sometimes you have to stay there for 2 nights, and sometimes people can leave the day of. So for me, I'm expecting to stay 1 night. Hopefully it all goes well, and that's all that's required, and my sister will come and get me the next day. We had to get her a medical certificate because, as I said, Melbourne's back in lockdown with Corona, and she's travelling from a place called Bendigo, which is just over an hour away, and you're not really meant to unless it's for medical reasons. And this is obviously a medical reason, and so we did a medical note for her to print out and bring with her travelling in case she gets stopped by the police on the way. She can explain what's going on. So she'll come get me. I have to have a pillow, which I'll wear underneath my seatbelt for the drive there. The doctor's going to give me like a compression bandage bra thingy, which I'll have to wear for a week, except when I'm in the shower. I can take it out I can take it off when I get in the shower, put it back on when I get out. The dressings will last for a week to 2 weeks. So my sister's probably going to have to blow dry those dry for me. It's fabulous having a sister. So basically he'll give me those compression bra bandage, and then he'll also give me a bra that I'll wear for 6 weeks after the surgery. I don't think that's normal. I have a feeling that I'm just getting that bra because I'm going private and I'm paying them in for the surgery. And like, they gave me a couple of things. They gave me some arnica tablets, which I have to take from the day before and then a week after, and they help prevent bruising. They also told me to take vitamin BQ10, which helps healing, and I need to do that for a week beforehand, and then for 6 weeks after the surgery I need to take those daily. Anyway, yes, I get my little freebie bra, and so he was saying, yes, you'll need to sleep upright initially and just kind of gauge how you go. Definitely, obviously, no sleeping on like applying any pressure to the boobs for 6 weeks. But he said just gauge how you feel. He said it's best to actually get up and walk around after the day after the surgery. So make sure that you're moving around and, you know, within reason, like nothing that's actually putting any strain. And he was saying that the only time he's ever had anyone really bleed after a surgery was people that have trouble after the surgery, or people that do a bit too much. Like he was saying that someone had been walking her dog and the dog pulled and yanked her, and that was 10 days after the surgery and she bled. So you just have to still be really careful until you're really healed. So anyway, so he ran me through all of the kind of the talking stuff of the appointment, and then I took all my top and bra off and we looked in the mirror, and he was just looking at the boobs, like he was gauging if one is bigger than the other and how the symmetry is and what that'll all look like after the fact. He also noted that, so I've got quite a few veins that run through my boobs, which I've always hated, but he was saying that how good that is, because basically the breast tissue around those veins is what he'll keep the nipple attached to, and the veins means that there's really good blood flow to that area. He was also saying, because my boobs are very, very heavy, and so he was saying he thinks that it's probably predominantly breast tissue and not fat, but what he'll do is do that anchor cut that I was explaining in one of my other videos, keep the nipple attached to the breast tissue, remove everything else, then move the nipple up so that, because at the moment my nipples are about here, and I think they're going to be about here, which is just like so exciting. But the thing is, so because I'm 6'1", there's a lot of breast tissue. So if that whole area needs to kind of stay intact, and it kind of has to come up into the boob, if that makes sense. Just madness. Yeah, so he will do liposuction to remove any fat in the breast, and then also there's like a little bit of breast tissue that you get around the top of your boob at your armpit, and he'll do liposuction there. I have very little fat in my actual waist. You can't tell, but I'm not like overweight. I just have gigantic boobs. So he said, look, you need 2.5 centimeters of fat to be able to liposuct around the back and in that area. He said he would try and he would see how it goes, but it's like borderline for me. So anyway, I'm hoping to get just as much liposuction as I possibly can, which I spoke to him about, and you know, he'll just do what's right in the surgery. So yay, I think that's it. I can't think of anything else. The payment, I have $9,000 left to pay, which I've paid $1,000. I'll pay another $9,000 a week before the surgery, and then I'll just phone them up and do a credit card payment over the phone, and then that's that. I think that there will be another invoice from the hospital when the anaesthetist, because the anaesthetist is separate. But other than that, once I get that receipt from them for the payment, I'll put a claim in through my private health, and I'll get $1,300 back, which is such a joke, but it is what it is. Okay, so that's that. In 4 weeks, I go in for the surgery, and I will run you through all of that. Did I mention? I don't think I did. Just on the morning of the surgery, when I get up, I need to have a shower with an antiseptic shower wash, like a Cetaphil, and then I head in, and the surgery will happen within a couple of hours of me getting there. So that's all great. What do you think? Is it exciting? I'm trying to explain it to him. He's not getting it yet. Hopefully, my husband's going to bring him in to the hospital the day after I have the surgery. So hopefully him seeing me there obviously will be very reassuring, but he'll understand where I am.
Come, Mommy, come, Mommy.
He's been in hospital quite a few times,
Come,
so he'll
Mommy.
get it. Yes, I'll come now. Anyway, that's it.
Come on.
So wish me luck, and I'll touch base once I'm probably in hospital. I'll be quite bored, I imagine. So
Bye.
say see you later.
Bye.
Bye. See ya.